Only on 13, the I-Team investigates veterans lost on the line.
We discover a nationwide problem with the suicide hotline intended to help our heroes and their families when they're in crisis.
Here's investigative reporter Jon Chrisos, who's now got the attention of Congress. John.
Every day, hundreds of veterans call or text the Veterans Crisis Line. It's a key piece of the federal government's suicide prevention efforts. But when minutes matter, we found a flaw, leaving emergency responders struggling to find the person crying out for help.
It was just before midnight. We were in bed sleeping.
That's when Rebecca Cummings got a terrifying wake-up call she wasn't expecting. 2 police officers at her home in Windham.
If the police are at your door in the middle of the night and you didn't call them and there's nothing going on, it's usually pretty bad news.
Cummings is a former soldier, Army wife, and now military mom.
I honestly thought they were here to talk about my son, who's away at basic training.
But instead, according to a police report obtained by the I-Team, police were dispatched here by the Veterans Crisis Line for the report of a suicide attempt. The text to the hotline suggested the person was feeling suicidal, had a plan, and wanted to act on that plan tonight. The Veterans Crisis Line thought the person who texted was Rebecca's husband, Greg,
who was in bed, asleep, been in a great mood. So I was a little taken back by that. I went upstairs, woke him up. He had the same reaction.
Turns out not only were police at the wrong house, they were in the wrong state. We pieced it together using police and federal reports. By default, when callers don't give their location, operators at the Veterans Crisis Line use public, often outdated websites to try to find veterans in immediate danger. In this case, the text actually came from someone down here in Texas who's now using the number Greg used when he lived in El Paso years ago.
There's got to be a better way in 2020. Soldiers move. They move every 2 to 3 years. They go to the field, they deploy, they travel all over the world.
If there's someone who's engaging and they need help, and the help isn't arriving, hugely problematic.
When we told Jenna Maynard with the National Alliance on Mental Illness about what happened, she called it a total breakdown in how crisis lines are supposed to work. She says police and crisis intervention teams need to have as much information as they can before knocking on any door.
So if they're showing up to the wrong place, then clearly the right kind of information is not getting conveyed.
The I-Team also flagged the problem for all 4 of our members of Congress. Is that acceptable?
It really is very troubling.
Senator Susan Collins sent a letter to the Secretary of Veterans Affairs asking what tools or resources the agency needs to make sure a caller's correct location can be found. And if it took legislation to allow them to have access to police databases or to ping phones in emergencies, is that something that you think that you would be interested in working on?
I would. So it may be a matter of authority that they need, but it may also mean that they need additional funding to get access to up-to-date databases.
And just like she did in the Army, Rebecca Cummings says she's ready to do whatever it takes. Do you feel like this is your next mission?
I feel it is. They're out there protecting us every single day. It's the least we could do to give back, is to make sure when they reach out for help that we have the most efficient means of getting them that help.
The Department of Veterans Affairs told the I-Team cases like this one are rare, but in a report, the Inspector General recommended the VA start tracking rescue efforts that end because the caller's location can't be found. And of course, we'll be sure to let you know when the Secretary answers those questions from Senator Collins.
Yeah, John, and I can't help but wonder about that veteran in Texas who initially texted the line. Were you able to find anything about that person?
For privacy reasons, there's not a lot of information about it, but we know that Maine police were actually able to find the person who texted that veteran in Texas. The VA apologized for the mix-up and says they've taken all necessary steps to ensure the safety of that person in Texas.
All right, John, we'll keep looking to you for updates. Thank you.
You've really shined a spotlight on what is a serious problem with our Veterans Crisis Hotline.
A nationwide problem the CBS13 I-Team has been fighting to get fixed all year. Veterans lost on the line. Now, after we exposed the issue, the VA has its orders and money from Congress to fix the flaw with the suicide hotline for our country's veterans. From a home on a winding road in Windham, all the way to the crowded chambers of Congress.
It was through your good reporting that this was brought to my attention.
10 months ago, a Veterans Crisis Line dispatcher sent emergency responders to the wrong suicidal veteran in the wrong state.
I heard a noise, my dog alerted. That is just unacceptable to me.
We discovered the crisis line doesn't have access to geolocation, meaning when veterans reach out, the person on the other end of the phone doesn't know where they are.
As a former soldier, as a military wife, and now a military mom, I want the fastest, most accurate way of tracking possible.
And soon, that should happen. The Department of Veterans Affairs not only has the money to fix that issue, Congress expects them to. The money is included as part of a massive year-end spending package signed by President Trump. Within the thousands of pages, this line, the department is urged to ensure the Veterans Crisis Line is able to utilize geolocation capabilities in order to ensure accurate emergency dispatch to persons at risk of imminent harm to self or others, similar to those of 911 call centers.
I worked very hard to get language that was included in the VA appropriations part of the omnibus appropriations bill.
The VA was given nearly $10.3 billion for mental health programs, $20 million more than the agency even asked for. Congress says some of that money needs to be used to deploy geolocation technology.
That's why I'm very confident it will be done, but you can be assured that I'm going to keep on top of this issue. This hotline truly saves lives.
A VA spokesperson told me the FCC is looking at that issue right now and working toward implementation.
I appreciate your following this story. It's really important.
Right now at 6, the CBS13 I-Team is on your side and getting results. Our reporting this year discovered a flaw with the nation's suicide hotline, leaving some veterans lost on the line.
Now some big changes are on the way. Here's Jon Chrisos.
Our investigation is making waves in Washington and now has the attention of the FCC, the Department of Veterans Affairs, and 2 United States senators. In fact, they say that investigation helped push forward a new law just signed by the president.
He was a hero to many people.
Marine Corporal Rory Hamill lost his leg in Afghanistan because of a blast from an IED. He lost his life after he came home because of suicide. His ex-wife says the pandemic is to blame.
You know, it stripped him from everything he knew. He couldn't do his public speaking. He couldn't go to school, to his outlet away from his own mind.
Experts say isolation increases the risk of suicide. It's even worse for many veterans who are already having trouble adjusting. The I-Team reviewed calls to the Veterans Crisis Line, a suicide hotline for veterans and their families. We found a 14% increase in calls since the pandemic started.
The pandemic is impacting all of us.
A veteran herself, Tracy Charette, is now part of the suicide prevention team at the Maine VA.
Asking for help is really asking for an opportunity to be pointed in the right direction.
The VA wants veterans to call for help, and when they do, they want to be there for them. But a flaw in the system exposed by the I-Team found some veterans getting left behind.
There's got to be a better way in 2020.
In January, police showed up at Rebecca Cummings' home in the middle of the night. Officers were dispatched there by the Veterans Crisis Line for the report of a suicide attempt. Turns out not only were police at the wrong house, they were also in the wrong state.
When people are in trouble and they're ready to reach out, you don't want barriers in the way.
Senator Angus co-sponsored the law to create a new 3-digit number to reach the Veterans Crisis Line. Part of that law also requires the FCC to examine the feasibility and cost of including an automatic dispatchable location, similar to how calls to 911 work.
If we have someone calling that is really in a tough spot and needs to be located, then I think that that is an important piece.
A preliminary report from the FCC found adding geolocation capacities would be a significant improvement to better enable locating acutely suicidal individuals who have made suicide attempts or who are at imminent risk of doing so.
So we don't have the kind of tragic situation that you've been reporting on.
To push for progress on that piece, Senator Susan Collins tells the I-Team she asked for specific language in next year's VA funding bill, directing the agency to add geolocation to the crisis line.
The VA's done a great job with this crisis line, but clearly further improvements are needed.
The FCC says the new 3-digit suicide prevention number 988 should be up and running by 2022. For now, veterans and others who need mental health services should still call the 10-digit number, this one right here. The FCC report about location tracking is due in 6 months. On your side, I'm Jon Chrisos.